viewers, this is Dr. Hiya Agarwal, fertility consultant at Neelkanth IVF Jodhpur. Today we will be discussing why the pregnant woman should undergo ultrasound. Ultrasound is a novel modality. Basically, it is a very old modality but has shown to have decrease and increase usefulness, especially in the female reproduction and definitely in the women who have got conceived and who are pregnant. Why it is so rampantly used is that because it does not have any radiation, so it doesn't affect the fetus inside, and it gives a proper knowledge of the fetus growing inside. And if there's any abnormality in the fetus or anything which is of any use, it can be told before the birth of the fetus, and accordingly the decisions can be taken. That's why nowadays ultrasound has shown to be an indispensable modality of investigation in the pregnant woman. There are two modes of ultrasound which are routinely used in the pregnant woman. One is transvaginal and another is transabdominal. In the early pregnancy, that is to say in the first trimester, the fetus growing inside the pregnant woman is very small, and visualizing it through the transabdominal scan is not possible, or if it is possible, it becomes very late stage in the first trimester. Therefore, usually the first scan is done with the transvaginal ultrasound. We can see what is the heart rate, how many fetus have been developed, whether it is a twin or a single pregnancy, and whether the cardiac activity which is approaching is nicely seen in the transvaginal ultrasound. It is usually recommended during the 6 to 7 weeks of the conception, especially in the females who have undergone embryo transfer, that is the in vitro fertilization for the conception. First ultrasound in the pregnancy is usually recommended in 6 to 7 weeks and usually done by the transvaginal route. It is specially recommended in the females who has conceived pregnancy after ART treatment or the IVF, because in these women we need to know whether the cardiac activity is present as early as possible, as well as we need to know what is the number of the fetus and how is the even if they are twins, what is the type of the twins available. All this knowledge can be very easily obtained through the transvaginal scan, and it is being obtained to the definite accuracy. After the first scan, the most preferable route of doing ultrasonography in pregnant women is transabdominal. It is more comfortable for the patients, and we can gain maximum knowledge with the transabdominal scans. Usually, transabdominal scan is preferred at the 3 months of around 12 to 14 weeks to see for the nuchal translucency. It is one of the genetic marker of aneuploidies, or whether the genetic structure of the upcoming baby is normal. Other than that, the third scan which is preferred is at the anomaly scan. This is the most important scan in the pregnant woman. It is usually done by 18 to 22 weeks. It is to see that all the organs which are developed in the fetus are in the proper order, or if there is any problem, then the reference and the opinion of the fetal medicine specialist can be taken. Other than that, after those scans, we usually do a scan around 28 to 32 weeks to see the weight of the baby, how is the lie, how is the presentation, and whether the baby is getting adequate flow, or if there's any problem then in the growth, then accordingly we do the serial ultrasound scanning to see to assess the growth. If there is everything is normal, then no other ultrasound is required during the pregnancy. When the women have conceived with the IVF treatment, then the ultrasound monitoring is required on a regular basis to visualize the growth, because these women are prone for preeclampsia. These women are prone to fetal growth restriction. Therefore, they are undergone a more intensive ultrasound monitoring. Also, the women who have twins as twin fetuses or a twin pregnancy, they also require more frequent ultrasound monitoring, because twin fetus may have more complications as compared to the women who have had a singleton pregnancy. Ultrasound modality is a very important investigational modality in the pregnant woman, and we advise or we recommend all the pregnant women to go for a proper antenatal checkup as well as antenatal ultrasound monitoring to avoid any unforeseen complications which we can avoid by seeing ultrasound. If you have any other query regarding ultrasound or you want to know more about the ultrasound requirement in the pregnancy, you can contact the number given below. Thank you.